Excited you are to be here today. We will call the meeting to order. I need to make a note that Gordy's going to be taking over for Gary today. So he'll be on our committee. I guess we've got to approve some minutes. Everybody get a chance to look at them?
So moved.
Thank you, John.
Second.
Thank you, Greg. All in favor?
Aye.
And
Aye.
opposed? Carried. We will move to Diana Fox. How are you, Diana?
I'm good. How are you?
Great, thank you.
I need a haircut. Here's in my eyes.
So does everybody.
I know. All right. So the first thing I have is it's an extension of a contract for AMP, which is Aging Mastery Program. And the group that puts this out there, the Population Health Collaborative, had offered all of those involved if they wanted to have an extension. And it's normally something that we do with groups. So we took them up on their offer to let us extend it out to have it held hopefully later in the year. Everything is the same in it. There's no additional spending. It's just simply to carry out the timeline to a later point in 2020. It should have finished mid-May. So we're just extending it if we can.
Awesome. It looked like John wanted to make a motion. He was dying.
So moved.
Thank you, John. Thank you, Gregory. Questions, comments? Hearing none, we'll vote. All in favor?
Aye.
Aye.
And opposed? Carries. Awesome. We're down one.
And if you're 55 or older, you can participate when we get to do it again. So it's free. The next thing is our RSVP grant award. The award is in the amount of $47,500, which was already in the approved county budget. And it's just to be able to actually accept that award so that we can carry out those duties.
So moved.
Thank you, John. Thank you, Gordy. Looks like we want the cash. Any questions for Diana? This should be an easy one, right? All in favor?
Aye.
And opposed? That'll carry as well. Number 3.
Oh, this was complicated. So essentially, we've been feeding more people. And so our existing contract with ARC originally was to have the meals only incur a cost of $223,927 from the period of July 1, 2019 through June 30th. And we've gone over that budget. It's all paid for. We're receiving additional stimulus funds of over $40,000. We've been allowed by all of our state regulatory agencies to be able to move from one line, for instance, congregate meals, where we're no longer able to provide those. We can use those monies to cover the costs of home delivered meals. So we needed to rewrite it so that it would just show that we were spending more money and where it was coming from. So this contract year will end at the end of June. And next time I see you all, we're doing the next go around of it. But so this is for a maximum contract total not to exceed now $263,927. And again, all of the additional costs have already been secured funding from the stimulus or from other lines that we weren't able to spend because we couldn't do those particular programs.
Thank you, Gregory. Thank you, Gordy, with a second. Do we have questions in regard to the meal service plan?
I just wondered, do we have the cash in hand or it just committed to it?
No, we actually have received 10,000 of the promised 40,000. And we already have the other cash in hand. So the stimulus, one of the stimuluses is for 40,000, and we have 10 of that. And then the other funds are from lines that we already have that cash in hand. We just aren't paying for those other items. Does that make sense?
So we're in a position where we're okay to wait for the rest of the money to come in then.
Oh, yeah, that's not an issue at all. In fact, they've been a little bit slow to bill us. They're busy. We've been asking them to give us our bill, but yes, we already have all of the other money.
One question. You said that there's more. How many more? I mean, just a roundabout number, just curious, or percentage?
How many more of meals or?
Yeah, yes.
Oh, gosh, let me see now. We were doing an average of maybe 115 a day, and we've increased by about 30%. So we're up to, it varies. We can come 160 sometimes a day.
Well, yeah.
Yeah, well, one of the things that we were able to do is move people who were getting congregate meals. We were able to move them into home delivered meals. So it simply like transferred that over. And then some people, they were just eligible for it. And especially with not being able to get out more, things like that, we were able to put them onto that rotation.
Thank you.
Everybody good with that?
Mhm.
No further questions. We'll vote. All in favor
Aye.
and opposed? That'll carry as well. 3.
And the
That's it,
last,
right?
nope, there's one more. This is just it's a renewal of a contract. We do consumer directed in-home services. And this is just to renew the existing contract for another year. Again, all of the monies were already in our budgets and approved for the county budget. This is where consumers can choose to have their own healthcare, like maybe a family member or something like that, that the agency then contracts with to provide the in-home care.
So moved.
Thank you, John. Thank you, Gordy, for the second. You have questions for Diane in regard to this?
I just wondered, how is it working with a family member serving as a healthcare?
Well, it's interesting. I almost wonder in the past year it went down. We actually put less into it this year than we thought we might. I'm wondering if going forward, though, that's going to be something that's going to actually go up just because people feel safer maybe with a family member that they could, contract. I don't know. Being the shortage of home health aides, I think that's also kind of a problem. So maybe more family members will be looking to do that.
Does there seem to be any fraud or any potential fraud in that program?
I don't think so. I think, they have to go through all of the training and provisions and things like that the agency actually would normally go through.
Thank you.
Other questions? So we'll vote. All in favor
Aye.
and those opposed? Carries. Diana, thank you very much.
Okay, thanks.
Appreciate it. I know we have Paul Bennett there somewhere. Saw his smiling face.
Yeah, that's right. Good afternoon, everybody.
Hi, Paul.
Guys doing well today. So I just have one resolution for the committee today. This is actually a grant amendment and budget amendment. We are getting some additional funds from the state of New York for our early intervention administration contract that we have, another $4,726. And then this has essentially been added in partly due to our advocacy around needing additional funding towards the lead changes that took effect last year in the state budget. As you know, the lead level was lowered effective October 1st. And, presumably, again, when things get back to normal, again, it's not quite been normal, as we're all aware, the last several months, but we are expecting to see an increase in children being referred to early intervention based on lead poisoning levels. It's an automatic referral. Essentially, when a child under the previous lead levels was above 15, that automatically went to the health department for a screening. Now, with it being reduced down to 5, any child with a blood level lower above 5 would now get referred. So the state has increased, again, some of the funding through the early EI admin grant to help cover some of those additional workload costs.
So moved.
Thank you, sir. Thank you, Greg, for the second. Questions for Paul in regard to this? Hearing none, we'll vote. All in favor?
Aye.
And those opposed? Everybody's good with it. Paul, nice to see you smiling. I'm sure you're sick of giving updates. Don't tell us anything you don't got about anything new, anything, you've been on vacation or?
Well, we're getting a little more clarity from the governor's press conference today. If you've seen the updates on that around potential reopening strategies and the phases 1, 2, 3, 4, and the different metrics that we need to go through in order to progress. So they're starting to get a little more clarity around that. We've been asking for weeks now exactly what this is going to look like. So it's starting to shape up a little bit. As I've continued to mention when it comes to this, I do have some concerns around the regional approach here. Again, we're going to, so to speak, be able to move forward and get stuck on pause based on what our entire region does. And that's, again, for us, the Finger Lakes region. And if you look at the metrics, which the governor has been very clear that, again, it's going to be driven by data and how fast, how quickly we're able to move forward. We're looking at hospitalization rates, and he's kind of lining that up a little bit more now with what we need to have. And, it's based on per 100,000 residents. So if you look at our Finger Lakes region, I think we're around 1.3 million-ish, maybe somewhere right around there, maybe a little bit less. We have to meet certain data points. So again, more to come on this, but at least we're starting to get some clarity, which is going to be very helpful. We're again putting together some information that we'll be sending out to businesses and other organizations within the county with some guidance around developing reopening plans and what they need to contain, so that hopefully when we get to phase 1 here and we get the launch on May 15th, which we're optimistic will happen, all of our essential businesses that'll be added in, mainly around construction, manufacturing, and some retailers, et cetera, will be ready to go.
Awesome, thanks. We appreciate
Paul.
everything you're doing.
Following up on that, Mr. Chairman, as Paul indicated, the state is looking at this on a regional approach. We just were on a conference call with the state budget director and indicated that we are one of the 5 regions that on the 15th, if our metrics and our data still continue to look positive, that we should be able to look at the phasing of reopening of the Finger Lakes region, which Genesee County is part of.
Good.
So that's one small sliver of good news, at least this afternoon, as of about 4:25.
All right then. Paul, quick question in regard to antibodies. Is that something that you got a comment on how they're testing, or if they'll be testing, or?
Yeah, so I mean, that's still fairly limited. Not much has changed since last Friday when we talked about it a little bit at the press conference that we had in the afternoon.
Yep.
It's still not widely available right now in our region. The state is still doing these small clinics here and there, these random samplings. They're talking about more availability specifically for healthcare workers and other settings. But again, access to that is not widely available for any just general from the public folks from Genesee County right now. Unfortunately, just like the testing, we seem to be lagging behind in getting access. We do know we are getting some results in from antibody testing because we do see those results that come through the through the health department. We have not had anybody as of that I heard last Friday, anyways, that had tested and shown they had antibodies. So there are some Genesee County residents that have been tested, whether they're at these random sites the state has or they're healthcare workers, but no one has shown antibodies yet as of last Friday. I haven't seen any updates since then.
We were updated over the weekend of some family members that were positive, so you'll probably see those numbers change a little bit.
Yep. So I mean, it's a rolling. We're a couple 2 to 3 days sometimes behind on those,
And it really is not I mean, it's no scientific data, right? I mean, it's just here and there, and it's more anecdotal than anything, right? I mean, it doesn't
Well,
tell much.
it's novel. We still don't know a lot about even what the antibodies tell us beyond, you were exposed and you have antibodies built up, are you
We're
able
not
to?
even sure if that.
That's right. I mean,
Right.
there's a lot of things that aren't even answered. It just gives us a level of exposure to the virus. So it is important data to help us frame kind of our response and understand how much of our community has been exposed.
Sure.
It doesn't really tell us much beyond that about how much protection and immunity, other things we have, since it's still too new.
Thank you for everything. We appreciate it. Any questions, Paul? Get back to work, sir.
All right. Thank you. Everybody have a good day.
Thank you. Do we have a Mercy Flight representative here?
Hello, yes, Mike Galuz is here from Mercy Flight.
Hi, Mike. Welcome. Thanks for joining
well,
us.
Thank you. Good afternoon to everybody. Just a brief report that was passed along to me to pass along so everybody can kind of know where we stood. For our year ending 6/30/19, we had some really big accomplishments that had some direct ties into the county. We had our new building at 8050 Call Parkway open up for our ground facility and all of our ground services. And we also took delivery of 3 of our brand new helicopters during that year, 3 Bell 429s, which are spread out between our Buffalo, Olean, Springville locations, and then also rotating through Batavia with the Bell 429 that we've had there for a few years now. Some service recaps. During that year, we received 121 requests for helicopter service, which also included some ground standbys from July 1st of 18 through June 30th of 19, which resulted in 47 transports. 60 of the transports were subsequently canceled by the requester as not being needed. 14 we had canceled due to some poor weather conditions that made it unable for us to fly. On a brighter note with the helicopter service, we were testing a 12-hour operation there in Batavia, and we have since gone back to our traditional 24/7 operation. So the helicopter in Batavia is functioning 24 hours a day, 7 days a week now. The ground service had a request of 9,720 calls, which resulted in 7,625 patient contact incidences, which include transports, lift assists, and some treatments that resulted in not transporting. We also conducted some training throughout the area during that time frame, some ground schools for some of the fire departments. We also did some Stop the Bleed programs, some pit crew CPR courses. We also did some career days with GCC, some DWI simulation drills, numerous fire department open houses, and various speaking events and parades and festivals, which is a great opportunity to interact with the general public and the other first responders in the area. Currently, as most people are aware, I mean, some of the challenges we've had lately have been obviously the COVID-19 situation that's going on, and we've actually done pretty well. We've been working very diligently to ensure that the crews and the patients have adequate personal protective equipment to prevent the spread of any of the COVID-19 disease. We've invested tens of thousands of dollars into PPE and decontamination units. We just took delivery of some isolation pods, which will help for some of the interfacility transfers with some of the COVID positive patients to limit exposure to our crews and to contain that so that it's not spread. And many other items that we've picked up along the way to make sure that we're keeping both the Genesee County residents safe and our EMS crews as well. With all this going on, unfortunately, one of the things we did have to postpone was the 2020 BASH fundraiser that we typically do in June, and we are looking to reschedule that hopefully at a later date once we kind of see what direction things go in and like that. So it's been kind of what we've been focusing on lately, and that's kind of where we're at for now.
Awesome. Thanks for the update. We appreciate it. Anybody got questions for Mike?
Yes.
Mike, you sent us some data, or someone showed us in regard to what you're seeing in the last 5 or 6 weeks with what's going on. Can you just comment on the number of calls and what that does for your, projected revenues and whatnot?
I'll be honest, I did not forward the data, so I haven't seen the most recent data. As a factual bottom line number, I can tell you that, overall, that call volume is trending down some as a whole. And again, a lot of that is due to the fact of, I think, with people being kind of taking the stay-at-home and social distancing thing to heart, that we're not seeing the things like the auto accidents and the other things like that that we would normally see. So a lot of those calls have kind of dipped off a little bit here lately, and that's not unique just to us. That seems to be kind of industry-wide for other providers within, both Genesee County and Erie County as well.
Sure.
So, yeah, sure, there is a bit of an a revenue impact with that, but, again, we're looking at ways that we can counter that and, try to help to cover some of the expenses for some of this additional COVID equipment that we've purchased, through help with grants and, through the federal government like that.
Good. Thank you for that. Appreciate it. Anybody else? Any questions? We all good? Thank you, Mike. We appreciate the update.
Thank you.
Have a great day.
Well, you too. Thank you.
Were we able to find anyone from Ag Society? I know we weren't quite ready we didn't have much pre-work, but anybody joined us from Ag Society?
Yes, Amanda Gallows here.
Hi, Amanda. How are you today?
Good. How are you?
Great. We're glad to have you. Thanks for joining us.
Okay, so normally Norm's doing this, but for some reason the link's not letting him in. He just messaged
Okay.
me that. So I guess I'll give it a whirl. Our fair numbers were up this year. Attendance, we had to go to 8 days versus having 5 days, just to support the exhibitors coming in from the county and neighboring counties. Oh good, Norm's here, so he can take over because he's better at this than I am. Norm, are you
You're
there?
doing great, Amanda.
Oh my God. Hi Jay, how are you?
Amanda, very good.
Good. I'm better at getting eggs donated for the United Way than.
And you're doing a fantastic job of that, by the way.
So, Norm, are you there? Well, he said he was in. I don't know.
Fast, Amanda. You're not off the hook just yet, right?
Okay, so yeah, so we'll see if he comes back in. Yep, so we've had to expand to get animals, exhibitors in, to have enough camping spaces and all that good stuff. So the fair is growing, unfortunately. He said that he can hear me, but nobody can hear him.
Can he unmute himself? Can he hold down on the space bar or?
Norm, they say to hold down on the space bar.
I think he's calling in.
Okay.
Is he calling in?
Sorry, guys.
No, nobody expected it to be perfect, Amanda.
We're still learning ourselves, Amanda. Don't worry.
Oh, thank you. I get to hold one of these tonight, too. Norm?
*6, is that the right thing you should press?
I guess I'm not sure. So does anyone have any questions? Because I'm good at blabbing through questions. And,
All right. I think the general consensus is that you guys have done a heck of a job over there in the last few years, taking something that, didn't have a lot of interest in it. And man, you guys are really hitting a home run with that. Does that make sense?
Yes, that does make sense. Yep. Even our open show events, outside of fair are growing and doing well. We're actually hosting a virtual horse show right now due to not being able to have live shows on the ground, and that's doing well.
To what do you attribute the success, Amanda?
I think teamwork, working together, communicating, working with the county, the community. 4-H, 4-H has a big part to do with it. So yeah, I think we've all worked together really well and, gotten some new blood in, and yeah.
I mean, it was an awesome thing for my kids doing 4-H with the steers, and I mean, it was really good for them. I think they learned lifelong lessons doing it.
Oh, for sure it does. Absolutely it does.
And it wasn't long ago that fair and that grounds, we didn't know what we were going to do about it, right?
Yeah.
And now we're really doing something out there, and we're really happy of that fact. Thanks for your efforts in regard to that.
Thank you. Thank you.
Gordy, do you have a question?
Amanda, maybe I missed this, but as far as the fair this summer goes, has that call been made yet, whether there's going to be a fair or not, or is that up in the air, or what do you think that'll happen?
Yep. So we had a meeting last Tuesday evening with the 52 other counties, state counties. And right now there's only 2 county fairs. Saratoga has canceled and Sullivan County Fair has canceled. But we're going to still try to proceed, as best as we can. Obviously, we're concerned with, are people going to want to attend? Are people going to bust down our door because they can't wait to get out of their houses? So, we're trying to proceed as business as normal, if there ever is going to be another normal. But, so.
What are the dates for the fair this year?
The 25th of July through August 1st.
Okay.
Amanda, when you were talking to your colleagues around the state, are any of them, like we're doing here and other businesses are doing, thinking about what kind of plans they need to put in place, sort of the new normal, the post-COVID-19 pause plans, once people start, coming to the grounds?
Yeah, and I think we're looking too, Jay, for guidance. We haven't really gotten, they just don't know, like crowd control, all of that. Like we've kind of decided that, or under the impression that we may have to cut back our grandstand events, which are gonna, kind of strap us financially with not being able to have the demolition derby and, the race cars if we can't have fans in the stands. We have talked about sanitation and, maybe having cones set up so people stand so far away waiting to get their, ice cream or cotton candy or whatever they seem to want. And the other fairs had those concerns too, how much is too much? Are people going to want to attend? So
Gotcha. Okay.
there's just not much. Did I answer your question?
Yeah. Just like the rest of us, it's sort of really starting to hit the ground in terms, to a certain extent. There's a lot of preparation and planning in front of us. And it's a matter of, we all learn from each other's best examples and, or in some cases, things we didn't do quite right. So hopefully you guys, like the rest of us in local government and others, are sharing these kind of things as we try to put ourselves back on some kind of sense of the new normal.
Yeah, I think we really understand that, there's no right answer or wrong answer at this time. It's all, unprecedented territory, and, we're just trying to move forward and do what's best for everybody.
Just a quick thought in that regard, Amanda. I know Darien Lake has no idea what they're going to look like this summer, but I also have heard through the grapevine that they are working on plans and thoughts, and maybe we could, and I could help hook you up with them, by the way. We're working with them from the EDC perspective, but why reinvent the wheel? I'm sure they've given a whole lot more thought to how they can get a group of people together than we could ever think about it. So if you're interested in that, let me know.
Very much.
Maybe we could hook you up with some of the things they're doing or an outline of their plan that might help you implement certain things in your plan or think about things we might not be thinking about.
Yes, that would be wonderful. Thank you.
I'm sure they'd be happy to help. They're awesome people over there.
Yep. Okay.
Great. Well, we appreciate the
email
update. Anybody got any other questions for Amanda? We're good with you. We thank you for coming.
Oh,
Florida.
thank you so much.
Thanks, Amanda.
You. Thank you. Bye-bye.
Have a great day.
Yep. You too. Bye-bye.
Jay, you're the main man.
Well, you got 2 contracts in front of you. You heard the Mercy EMS. I sent you a note today about what one of Mike's colleagues, Scott Wooten, told me with regard to where they are financially, that they did get some PPP money. They also got from FedStim 1 funding because of their combined operation, both Mercy Flight and Mercy EMS, which has, if you're not totally familiar, we are the only county that actually has that ground service that has the Mercy name connected to it in their 8 county region. So, you know, that also ties in. You heard Mike talking about both what the ground service has been experiencing and also what the flight service has been experiencing, and the notion that without a lot of elective surgeries and other things, people in general were not calling, and they had to some extent about a 40% drop in their number of actual service calls, you know, and that's literally since the beginning of this year. But again, you know, they're moving through it with regard to both the commitment that they have and obviously their significant presence here in the county, both at the county airport and there on Gateway 2 across Route 98 from the original county industrial park.
I think we all understand the importance of their health in our community. I know that there has been some discussion, so I guess I'll ask the committee, you know, just amongst the legislature in regard to how and what we're going to do about the lack of revenue we're going to see. And I know there's been comments in regard to this having already been in the budget. And so, you know, I don't know how you guys feel about what we should do with this. Pass it and let the full legislature have a discussion about it? Or is this something we should be holding off on until we understand what's going on with our revenue? Thoughts from the committee?
Is there any real threat to holding off on this for a little while?
No, I wouldn't think so, Andrew. Greg. The consideration is we'd like to think that between the governor and Mr. Mojica, that they'll very quickly, or not quickly, fairly soon start telling us what they're going to be doing to the state budget, which will be, again, for the first 30 days, which is April of 2020. And then we start looking at what else does that mean to us, both in terms of general state aid, as well as obviously sales tax, and sales tax being the really big driver, and the potential, and I can continue to use that word with regard to whether FedStim 4 really does provide state, local, but really county and local government assistance when and if that bill by the end of this month, hopefully, you know, is passed, and another $1 trillion+ is put into play across the country.
I guess my
That's
thoughts
the
were just,
wild card, right? Sorry, Greg, go ahead.
I was just thinking, you know, maybe holding off on these 2 items until we get a little more clarity, because I think we're going to do some more analysis on the outside agencies as well. So,
Was that okay with the Ag Society as well? That's not a hurry, Jay?
Well, the only thing is obviously if they actually decide that they put a date certain as far as the fair is concerned, that's really something we do as a reimbursement basis for once the judging has occurred, the premiums and things. So it's not that it actually is integral to their quote unquote front end operation or their gathering of resources. It's more a matter of if they actually have it and they do the judging, then we make the payment based on the invoices. So we even have a little bit of time there to not necessarily have decided, say, by, you know, sometime in the beginning of June.
Well, our next meeting's June 1st.
Yeah.
So for us to maybe table this and let 4 weeks of knowledge come to us over the next 4 weeks is probably not a bad idea. Anybody else have thoughts on that? Sounds like Greg's in agreement.
that was my thought.
I make a comment. I believe that the health and safety of the community definitely would be the priority. But I think, as Greg has pointed out, everything is still so fluid. And if we can just hold off, and I agree with you, Andrew, that we'll approach it in June, maybe there'll be a little bit more clarity.
So if we table this, and maybe Pam could remind me in June that we need to at least be thinking about this, and I'm sure we'll be talking about a lot of it, but we could table this now and bring it up again June 1st or at another time.
Yeah.
Gordy, does that make sense to you?
Yeah, I agree. It's in keeping with what we've been doing elsewhere.
If we have the time, we've been taking the time to gain more knowledge, right? So let's do it in this case. And it sounds like that was a motion, was it, Gordy?
Yes, let's do that.
I'll second that.
Thank you, Greg, for the second. All in favor of tabling this?
Aye.
And opposed? So carried. We'll table those 2 and make sure we get back to it. Thank you for that.
Was that a motion to table both?
Yes. Do we need to do it separately?
No, just as long as that's clear.
Yep.
Thank you.
I thought I saw Gordy mouth both.
I saw it.
Thank you, Pam. Which brings us to you.
And your next meeting is June 1st. And certainly if you wish to have both of those agenda items back on the agenda, you can do that. Thank you.
Okay. Maybe you could remind us. I don't have a chair report. I think, again, we wade through this and we allow things to happen. As Jay said, the funding through the next stimulus bill is really the wild card here. I don't know that we have a lot of other good news to look forward to or think could happen here. We understand the issues at hand, and that could be a savior for us. And if it doesn't happen, we'll have to deal with it that way. So we'll just play it by ear a little bit and see where things go, not only from a health and human services perspective, but an entire budgetary perspective. Anybody have anything for the good of the county? I will accept a motion to adjourn.
So moved.
Second.
Thank you. Thank you for the second, Gordy. All in favor of adjourning
Aye.
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 and opposed? Everybody's good with it. Thank you all very much. We appreciate it. Thanks for everything, Pam.
Stay well, stay safe, everybody.
Absolutely true.